Sertraline is a selective serotonin reuptake inhibitor, SSRI, indicated to treat major depressive disorder, social anxiety disorder, and many other psychiatric conditions. In this video, let's find found. What is sertraline? What is sertraline used for? Contraindication. What are the side effects of taking sertraline? How does sertraline work? How to use sertraline? What is sertraline? Sertraline, sold under the brand name Zoloft among others, is an antidepressant of the selective serotonin reuptake inhibitor class. The efficacy of sertraline for depression is similar to that of other antidepressants, and the differences are mostly confined to side effects. Sertraline is effective for panic disorder, social anxiety disorder, generalized anxiety disorder, GAD, and obsessive, compulsive disorder, OCD. Sertraline was invented and developed by scientists at Pfizer and approved for medical use in the United States in 1991. It is on the World Health Organization's list of medicines. It is available as a generic medication. In 2016, sertraline was the most commonly prescribed psychotropic medication in the United States, and in 2020, it was the 12th most commonly prescribed medication overall in the United States, with over 38 million prescriptions. What is sertraline used for? Sertraline is indicated for the management of major depressive disorder, MDD, post-traumatic stress disorder, PTSD, obsessive-compulsive disorder, OCD, panic disorder, PD, premenstrual dysphoric disorder, PMDD, and social anxiety disorder, SAD. Common off-label uses for sertraline include the prevention of post-stroke depression, generalized anxiety disorder, GAD, fibromyalgia, premature ejaculation, migraine prophylaxis, diabetic neuropathy, and neurocardiogenic syncope. Contraindication. Sertraline is contraindicated in individuals taking monoamine oxidase inhibitors or the antipsychotic pimozide. Sertraline concentrate contains alcohol and is therefore contraindicated with disulfiram. The prescribing information recommends that treatment of the elderly and patients with liver impairment must be approached with caution. Due to the slower elimination of sertraline in these groups, their exposure to sertraline may be as high as 3 times the average exposure for the same dose. Side effects: nausea, ejaculation failure, insomnia, diarrhea, dry mouth, somnolence, dizziness, tremor, headache, excessive sweating, fatigue, and decreased libido are the common adverse effects associated with sertraline, with the greatest difference from placebo. Those that most often resulted in interruption of the treatment are nausea, diarrhea, and insomnia. The incidence of diarrhea is higher with sertraline, especially when prescribed at higher doses, in comparison with other SSRIs. Pharmacodynamic. Sertraline improves or relieves the symptoms of depression, OCD, post-traumatic stress disorder, obsessive-compulsive disorder, panic disorder, and premenstrual dysphoric disorder via the inhibition of serotonin reuptake. Clinical studies have shown that it improves cognition in depressed patients. It has less sedative, anticholinergic, and cardiovascular effects than the tricyclic antidepressant drugs because it does not exert significant anticholinergic, antihistamine, or adrenergic, alpha-1, alpha-2, beta, blocking activity. The onset of action and beneficial effects are usually noticed after 6 weeks, for reasons that are not fully understood and currently under investigation. Mechanism of action. Sertraline selectively inhibits the reuptake of serotonin, 5-HT, at the presynaptic neuronal membrane, thereby increasing serotonergic activity. This results in an increased synaptic concentration of serotonin in the CNS, which leads to numerous functional changes associated with enhanced serotonergic neurotransmission. These changes are believed to be responsible for the antidepressant action and beneficial effects in obsessive-compulsive and other anxiety-related disorders. It has been hypothesized that obsessive-compulsive disorder, like depression, is also caused by the dysregulation of serotonin. In animal studies, chronic administration of sertraline results in downregulation of brain norepinephrine receptors. Sertraline displays affinity for sigma-1 and 2 receptor binding sites, but binds with stronger affinity to sigma-1 binding sites. In vitro, sertraline shows little to no affinity for GABA, dopaminergic, serotonergic, 5-HT1A, 5-HT1B, 5-HT2, or benzodiazepine receptors. It exerts weak inhibitory actions on the neuronal uptake of norepinephrine and dopamine and exhibits no inhibitory effects on the monoamine oxidase enzyme. Half-life. The elimination half-life of sertraline is approximately 26 hours. One reference mentions an elimination half-life ranging from 22 to 36 hours. Dose. Major depressive disorder. Indicated for major depressive disorder, MDD. Tablets. Initial dose, 50 mg p.o.q.day. May increase by 25 mg at weekly intervals, not to exceed 200 mg q.day. Capsules. Do not use to initiate treatment, only available as 150 mg or 200 mg doses. Use another sertraline HCl product for initial dosage, titration, and dosages below 150 mg q.day. Refer to prescribing information of other sertraline HCl products for the recommended dosage for those products. May initiate capsules in patients receiving 100 mg or 125 mg of another sertraline HCl product for at least 1 week. Recommended dosage, 150 mg or 200 mg p.o.q.day, not to exceed 200 mg q.day. Obsessive compulsive disorder. Indicated for obsessive compulsive disorder, OCD. Tablets. Initial dose, 50 mg p.o.q.day. May increase by 25 mg at weekly intervals, not to exceed 200 mg q.day. Capsules. Do not use to initiate treatment, only available as 150 mg or 200 mg doses. Use another sertraline HCl product for initial dosage, titration, and dosages below 150 mg q.day. Refer to prescribing information of other sertraline HCl products for the recommended dosage for those products. May initiate capsules in patients receiving 100 mg or 125 mg of another sertraline HCl product for at least 1 week. Recommended dosage, 150 mg or 200 mg p.o.q.day, not to exceed 200 mg q.day. Panic disorder. Tablets only. Indicated for panic disorder, PD. Initial, 25 mg p.o.q.day. May increase by 25 mg at weekly intervals, not to 200 mg q.day. Post-traumatic stress disorder. Tablets only. Indicated post-traumatic stress disorder, PTSD. Initial, 25 mg p.o.q.day. May increase by 25 mg at weekly intervals, not to exceed 200 mg q.day. Social anxiety disorder. Tablets only. Indicated for social anxiety disorder, SAD. Initial, 25 mg p.o.q.day. May increase by 25 mg at weekly intervals, not to exceed 200 mg q.day. Premenstrual dysphoric disorder. Tablets only. Indicated for premenstrual dysphoric disorder, PMDD. Continuous dosing. Initial, 50 mg per day continuously, every day throughout the menstrual cycle. May increase by 50 mg per menstrual to up to 150 mg per day if necessary. Intermittent dosing. Initial, 50 mg per day intermittently, only during the luteal phase of the menstrual cycle, i.e., starting daily dosage 14 days before the anticipated onset of menstruation and continuing through the onset of menses. Repeat intermittent dosing with each new cycle. May increase to a maximum 100 mg per day during the next menstrual cycle. Subsequent cycles, 50 mg per day during the first 3 days of dosing, followed by 100 mg per day during the remaining days in the dosing cycle. Safety advice. Advice and warnings for the use of sertraline, Zoloft, during pregnancy. FDA pregnancy category C risk cannot be ruled out. That's all the information about sertraline we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.